like to start out with a really easy question, and that is, what do you like most about practicing traditional Chinese medicine? What do you enjoy the most about it?
So I enjoy the hard problems. Hard, it's not simple. Sort of like the people said, okay, I just stress and like this. So I like more the difficult problem, when I work for the cancer, and you see cerebral palsy and Huntington disease, and all these kind of the difficult problems.
So you're more.
So this is sort of more the challenge, but it's more hard too. Yeah.
So you like the challenging problems, the more complex kinds of issues that people have, not the simple pain in the shoulder, but more like a disease or a condition, something like that.
Yeah, right.
Because it challenges you to have to figure out what's going on with the.
This is one thing. Then you can through and the people how they deal with all these problems, and then the doctor patient how they work together and get the benefit. Say the MS. So all this kind of is very challenging with the patient and the doctor. They need to work together. Yeah.
So you like the challenge of working with the patient and helping them work together with you like a team.
Yeah, right.
Okay. What do you find is the most challenging thing about your practice? What is the most difficult part of your job?
Difficult is you ask the patient when they follow your the direction, but they won't follow. So they just rely to you help me, not what I do. I should do. So this is the challenge.
They want you to solve the problem, but they don't want to participate.
Yeah.
Just let you solve it.
Yeah.
You fix it.
See, this is the most hard.
Oh, I see. So people just come in and they just want you to fix the problem.
Yeah, but when you work for some problem, you need the patient help you. Example for the diabetes, right? And they need to know, they need to real watch and what they eat. But when you talk to them what they should eat, what they should do, and they said, no, this is too much for me. So then you know this won't work good.
Oh, I see.
Yeah.
What are some of the conditions or the imbalances or the illnesses that you see the most in your patients who come in? What do you see the most of? I know there's a variety, but do you see more of certain things that people have when they come in?
With the infertility.
Infertility is, okay, that's a lot. Okay.
So then it's with the cancer patient.
Cancer patients?
So,
okay.
Then now it's a lot of the mental issue.
Mental issues. Okay. What kind of things do you think that are going on in our society that are bringing more patients like this to you, people with infertility problems and cancer and mental illnesses? What do you think is causing these problems?
Balance.
Balance?
Yeah. The body is not balanced, so this is so most of the people think this is people told me said beside I have breast cancer, other I'm fine. I work just great. Then you think when you have the breast cancer, this means your body is not doing good, right?
Right.
But if beside this, then they think I'm doing fine. Then you know this is not fine. So they need to recognize, they need to get their body is back the balance, and then they can stop the cancer growth.
So they think everything's fine except I just have cancer in my breast. If you just take away the cancer, I'll be fine.
Yeah.
But you have to make them understand it's the whole body is not balanced.
Yeah, right.
And they have to fix the whole body.
Yeah, right.
And then the cancer
So
will
the
not come
cancer-
back or grow.
Yeah, right. But cancer is just show the symptom. This is always the symptom. But the cause is, so they need to work for the cause. So this is why, like when you have the cancer after surgery, and then later, if you're not getting your body balance, later the cancer come back or they spread to the other place. So, see, this is the reason we said that you need work, you need to take away the symptom, but at the same time you need to restore your body, the balance.
What are the kinds of ways, in your opinion, that your patients are having unhealthy behaviors that lead to imbalance? What are you seeing in your patients in terms of why they get out of balance?
A lot is the diet and stress.
Diet and stress are the main reasons.
Yeah.
Okay. So eating unhealthy food. Too much of what do you think are they eating? And not enough of what?
I think a lot of people think that they're doing just the fun, and they eat very good and very good diet. But when you ask the detail what they eat, some people will say, "Okay, I only eat vegetable, no meat," and so I like the salad. So when they bring this to you, immediately you know, and they lack the protein. So the protein is the body need, but they didn't get. So then the vegetable, actually, if you eat too much raw vegetable, your body cannot absorb that. Just make your body is more done. So this is why I saw a lot of patients are vegetarian, and there is energy very low and very weak.
Really? Do you
Yeah.
tend to see a lot of vegetarians
Yeah.
in your practice?
Yeah, and then when I check the pulse, is very weak. Mainly is the kidney energy.
Kidney energy is
Yeah.
weak.
Yeah,
So you feel like they're deficient in protein.
yeah.
Do you feel like if they would eat more vegetable protein, like beans and peas and, seaweed and things like this, can that help, or does it have to be animal meat?
Depend on the person. And because if you eat a lot the vegetable protein, and your body cannot absorb. So if you didn't absorb, even you eat a lot, just like when the people they take the calcium, then they go check, still is the a deficiency vitamin D and like the calcium is low.
Calcium.
Yeah. So, but when they have this, then they just not work because the body don't absorb. Not because they didn't eat. They take, but the body don't absorb. So.
Are you aware of research that talks about how too much animal protein can cause disease like cancer, acidity in the body, and maybe actually kidney disease because the kidneys have to process too much protein, make too much uric acid, all this?
I think this is you need to know how much you should eat, and how you process them.
Do you think it's different with different people? Like different people respond better to more protein, and some people respond better to less protein, or is it the same for everyone?
No.
Or? No.
As each one is different.
Each one's different.
Yeah, and the need is different. Just like the baby, they just need a little bit, and with the adult, they need more. Then with the type of the lifestyle, and they need the difference. Yeah.
Do you feel like people in America are eating too much processed food? Too much food with the chemicals and not the wholesome natural food, or is that?
I think yes. Yes, and then actually, most of the people think that they know what they eat, they should eat, but actually they don't know what they need.
And how do you tell?
How do you tell? So, this is they need they need go to a professor and get some counselor when the body still is not doing better. So when the body beginning is not doing better, not doing good, and they need some advice and give them the good direction.
How do you tell though what foods a patient might need more of or less of?
So example, if when a patient comes to me, so I will check them pulse and look at them tongue and look at them body the symptom. Then I give them the suggestion what they need, what they should avoid. So then this is how I talk to the people and what they should do.
Based on the energies that are high and low in the body.
This is when we check the pulse and they show the different organs, the energy, and each organ and the pulse is different. So we depend on this. So this is why, one time when one of my patient coming here and said that her back just hurt. So she went to see the different doctors. Is didn't get any better. But when she's coming, so when check her pulse and look at her symptom, like this I talked to her, and she has a gallbladder problem. So then she go back to her doctor, and the doctor did an ultrasound for her, and found that her has the bigger gallstone there. So this is.
But you could tell from the pulse and the tongue.
But I don't know exactly what's the problems. But this area is the problem.
You knew it was the gallbladder energy was not good.
Yeah.
Yeah. Interesting. Very interesting. You also mentioned the stress. People have too much stress.
Yeah.
How do you recommend that people reduce their stress?
So I think that acupuncture is one way. And sometimes if they can use some the herb, a lot of the Chinese herb is working very good for this. Then they can through generally listen the soft music and listen some the joke or watch the funny movie. So all this is
humor.
the option.
Okay. Okay. Do you recommend any forms of meditation or qigong practice or anything like that?
So this is depend on each person. Yeah, depend on the person, and so because the qigong they have the many different kind, and you need it's not just okay I want to do this and then I can do it. It's better it's got some some teacher and guiding you. So I don't want, so I'm not suggesting and they just go and do. Sometimes if you got a guiding and show you how to do, and then you got a good result. Just when you go, when you go get the herb, and the herb said, okay, this is for the depression, but you don't know what causes your and the depression. They can have the low energy can cause, but they can have the high energy can cause either. So you just need and work.
So what you're saying is the qigong needs to be specific to that person's need,
Yeah, right.
and that you need to have a teacher who knows which qigong to teach them.
Yeah, right.
So if they just go to any qigong, it might not help.
Yeah, right. But this is not because they are not good, and it's just because you didn't get it right.
The right one.
Yeah.
Yeah. If they're doing the low energy qigong, but their energy is high, maybe it's not the right fit. It
Yeah,
doesn't
right.
help their condition.
Yeah, right.
Yeah. That makes sense. So, talking a little bit more about the kinds of mental illnesses that you might work with. You mentioned that mental illness or mental problems might be one of the large groups of people that you see. As a counselor, I work with people that have, really three primary conditions, I would say. One is anxiety, one is depression and mood disorders, bipolar and depression, inability to control emotions and negativity. And the third one is like ADHD, hyperactivity or cannot concentrate, cannot focus. Can you talk about how your practice can help those three conditions?
Yeah.
The anxiety, the mood problems, and the ADHD problem.
Okay. So, can just hold a minute?
Yeah.
Yeah.
Oh, you want me to pause? Okay, sure. You have to check on a patient. Okay, no problem.
The bipolar, right?
Mm-hmm.
And the bipolar depression and the ADD, and there is different.
And anxiety.
Yeah.
Also.
So like the most when the bipolar, and we said the liver energy is high. So then they cannot control the mood. It's mostly they got a very like the outgoing, like the angry and all this. So the easy get. So this is more we work for the liver, and then with the depression, a lot. This is depend on the patient, but for my experience, and a lot is because of the weak energy, and all they deal with some problem, and for a long time. They're sort of like from the the very like a disciplined, and the body didn't doing good. But when you check them, a lot there is energy is very low.
So you think maybe they don't have enough energy to overcome the problem that they have, so they get stuck in the depression?
Yeah, right. So then with the ADD, and this is mostly happens like kids. And so there is sort of like the function is not good and like this. So it's so they have the different kind of, as some is because they're weak. And they're weak, so you need just get them more stronger, and then they can focus better. So then the other kind is because there has too much, and
too much energy.
Too much energy, and still is the liver energy is too high, and so they will go the different place. So if you can bring them down and change the diet and all this, so then we'll have them is get the body balance. So
how can the diet? What changes to the diet would you recommend for someone with those conditions?
Example, if they're weak, then you need help them digestions better, get better, and so need more the simple, more the stronger food is bring up the energy. So if there is have the too much, then you need control the no junk food. Do not eat too much sugar and all this stuff, like
sugar.
The pizza and all this.
Mm.
So this is need to cut down there.
This would be for which condition now?
Like the ADD, where the hyper.
So then you want to reduce the junk food,
Yeah.
sugar and processed food.
Yeah, right.
Eat more vegetables and fruit and
yeah, right.
healthier food. Yeah, protein. Yeah. What about anxiety? What do you see with anxiety normally?
The anxiety.
Panic attack, fear, worry.
This one thing need to care for is need to make sure they don't have the heart disease. Heart.
Oh, it's related to the heart?
Yeah, because when they have the real heart problem, so they feel anxiety too. So this you need to make sure they don't have this issue. Otherwise, and this should be very serious. You need ask they go see the doctor. Yeah.
So if you see weak heart energy with those patients, you recommend they see their heart doctor.
They need and check their heart is okay.
I wonder people that have. I'm just wondering in my mind whether people that have the anxiety problem related to the heart, is it something when something maybe bad happened to them that caused them to be afraid or sad, how that maybe affects the heart energy?
So this is the one issue, but some is the real has the problem, so they need to go see the doctor. Yeah.
Okay.
Yeah. Then a lot they have thyroid problem, they can have this issue. So you need to know they don't have all this issue. Then otherwise you need you need to talk to them, see the doctor, and get the checkup. And
that will affect your treatment, the way that you treat.
No, they're not against it. They're not against.
What I mean is, if you find out someone has a heart condition also, then you will treat them a little bit differently. You will with the.
No, this is just depend on when I check their pulse, and it depend on the pulse and give them what they need. But in the same time, I still they recommend they go see the doctor.
I see.
And follow up.
I see. I heard it said one time by a great healer who she is doing healing of cancer patients actually she has a clinic in Mexico, because in the U.S. the government says it's illegal to say that you can cure cancer now.
Actually, you never talk to the patient see and you can cure the cancer. Never. And because why I said like this, no one can promise the future. And because as you know, any person, and they have the cancer cell in the body. Just how this is the show up. So when your body is not doing good, then they show up and become
start to grow.
The cancer.
Yeah.
Yeah. So see, because of this point, you never see any this. Even you don't have the cancer now, maybe later. So I think this is right. You cannot see, and no one can promise the people is no cancer. Yeah. So because this is, I agreed.
And she said, this is Charlotte Gerson, son of Dr. Max Gerson, who invented cancer treatment back in the 1930s and 40s. She said what she finds is when she builds up the strength of the person by giving them healthy food and reducing stress, she says all the diseases go away, not just the cancer. It all, like when you build the person's health and strength, it clears all the disease. Do you see that when you do that with the acupuncture, that other conditions maybe go away as well?
Yeah, they will help another condition, but you cannot see all there is go away, because remember what is the Bible taught to us. And right, if your everything is go away, it means you never die.
Mm-hmm.
But this, this is not true.
So disease will always be there in some degree.
Yeah, and just how you how you work for your body, and then you can stand in the good point. So today, example like today, I see the one person is 91, but she's still
91.
She's still driver. So with this point, so I think she's doing great
for her age.
Yeah, and but she's still and has different issues. Even she's doing great, but she's still
has some issues.
Yeah.
So we always have issues, but your point is, you want to live the quality of life.
Yeah, right.
Good quality of life.
Yeah, right.
And be able to function and take care of yourself, but you'll never be free of all disease.
Yeah, right.
Understand?
Yeah.
And I know you have some experience working with the neurological diseases. You mentioned, we talked yesterday about Huntington's disease, and I know you also have worked with cerebral palsy, and I think I read somewhere on your site that you had dealt with multiple sclerosis, MS, as well. Can you talk about how the Chinese medicine, traditional Chinese medicine, helps heal the brain? Because is the brain one of the organ systems in the that you diagnose, or does the brain? How does the brain get healed through the?
Actually, is cannot see it here like before we talk about it, but just example like when we talk about the MS, right? So when this disease and they can process is very quick. A lot of people is on the wheelchair, right? And with the Chinese medicine, and then we look how can get them body the balance and bring them back to the quality life. So this is like what look at is then I need to depend on the patient and how the body and the energy, and see if they need reduce or they need increase. Like example, like most I saw is like this type of the patient, the lung is the weaker, and the kidney is weaker, and actually the liver is stressed. So I need to depend on this and try and get them more balance and strengthen the lung and the kidney and reduce the liver stress.
And that somehow helps cure the brain.
Yeah. So we said it's the brain, and so when the different, so we talk about the motion, right? And a different motion and connected to the different organ. So then through this organ and work, and then have the motion. And then through all this, get the brain the energy flow, and have them functions better. So, like example, we said when your the people is always happy and like this, and we said the heart is stronger. So when the person always worry and like this, then we said the spleen and the energy is weak. So when you bring up the energy, and then they won't worry too much, but they are same the situation, but they can much better.
So people who worry a lot have weak spleen energy.
Yeah.
People who are happy have strong heart energy.
Yeah.
People who are sad, what about them?
The sad and the most lung.
Lung energy is weak.
Uh-huh.
What about angry?
Angry is more liver.
Liver weak or strong?
Liver too much heat.
Too much heat in the liver?
Yeah.
Okay.
But then when you face to each person, they're not just this sample. Then you need get the whole compound.
Or
Compound. Sort of all the conversation and all the unit. And then then work for them the whole body balance.
Yeah, so it's a connection. It's not just one organ system that's weak. It could be several things going on.
Because in the all the Chinese the Chinese medicine book is talk about if you know the liver has the problem, then you know they will affect your the stomach and the spleen, and then you doesn't want to eat. So when you get angry, the same time you don't have the appetite want to eat something. So this is how they affect each organ.
So the anger in the liver shuts the stomach down and makes the spleen weak.
Yeah.
Also. Huh. It's very interesting. I find it fascinating, the relationship between the organ systems and how they work together. And it would be great if we understood more about this in our culture. Do you feel? What about diseases we haven't talked about at all yet, like Parkinson's or Alzheimer's or dementia, something like that? Do you?
I think this is so sort of you recognize what's cause, but you want building up this strength is hard. Yeah.
So all of those conditions you can deal with in the same manner by focusing on what organ systems are weak and how you can build them up.
Yeah.
And that will send more blood flow, more energy to the brain, and create more balance in the body. Okay. Do you feel like there is... So
this is the Huntington disease. This is is the brain. But then actually, when I treat the patient like this, I didn't put the needle on the brain, but it just through the body and the energy, and then work for the brain.
Because the brain isn't one of the organ systems, is it?
It's the organ system. Yeah.
Is there one for the brain also?
Yeah.
Oh, I didn't know that.
Yeah. So this is we call the special organ. Yeah.
Okay. But you don't normally needle the brain directly, right? Or do you?
Yeah.
Sometimes.
Yeah.
You can. Wow. Wow.
A lot like a stroke, and the treatment just straight they use the needle on the head.
I see. And I think I read somewhere that your mother maybe had a stroke or some kind of paralysis.
No, my mother is
grandfather. Grandfather, and you treated your grandfather, right?
Right.
And you were able to bring him back to normal function in several months using.
Yeah.
And did you put needles in the brain area at that time, in the head, neck? Yeah. Interesting. That's fascinating. What do you think is the most challenging neurological disease to treat? Do you know? Brain disease or neurological disease, or are they about the same?
Yeah, so I feel like I think the very challenging disease is like all this, but actually I think it's more challenging is the infertility. Yeah, it's seem like for the most we know when the patient is coming and they was told me that I will have the treatment for the infertility and next week. So do I need to come in here for the acupuncture and before the treatment or after the treatment? I said no. It's not
that
simple.
quick. Yeah.
Then I said, if you really want to help you, and come in several months before, and try bring up your body balance. Because with the infertility, why they have the infertility? Because the body not balanced. When you try and from the not balanced body to the balanced body, and then they can process and go through the process. So you need time. If just like you plant flower, when you put the seed in, and the seed need the grow, right? And then they can have the little plant. Then they can have the what do you call the flower? So otherwise, you not put the seed, and today and tomorrow you see the flower.
It takes time.
Yeah, they will take time. It's the same in your body.
And proper conditions, for balance. What about can you talk a little bit about some of the different methods you use in Chinese medicine and how they're I know they're all basically doing the same thing, trying to achieve the balance, but how are they different? For example, like acupuncture and say moxibustion and cupping. How would those be similar but different? Why would you use cupping in one situation, but then maybe moxibustion in another, or maybe acupuncture in another?
This is just you need to depend on the patient need, and depend on the situation. Yeah, like some situation you need use the electricity, like the some patient when you use the electricity and it make it worse. So you just need to depend on each.
It makes the what?
Worse.
Warts?
Worse.
Oh, it makes it worse. Oh, like if you put electricity, it will make the situation worse.
Yeah.
But some it will make it better.
Yeah. So then you just need to depend on the situation they need. Yeah. This is not like this, just a sample. Okay, this patient need electricity. Maybe the time they need, then the next time they don't need.
I guess what I'm trying to understand, I get that part, that everybody needs a different treatment, but what I'm wondering is, so if you're focusing on a particular point, what makes you decide, I want to put a needle in there, or no, I need to suck with the cup, or no, I need to put the flame in the heat? What's the reasoning behind why you would choose one of those three methods on the same point? What do they do differently to the point?
They do the big difference. Sometimes, even the same point depend on the combination. So this is an example, your same chicken, right? Chicken, the meat.
Oh, chicken. Okay, yeah.
So it's the same chicken. If I fry them, you got the taste and the different than you boil them, the taste. So then, and when the people and who's already has a lot of the wounds, and you give them fried chicken, then just make this is worse. So, but if the people and so their body is like a cold and like this. So they can eat fried chicken is no problem.
Let me ask you about my arm yesterday. You chose to put needles in the lower part of my arm, in my lower arm, in my hand, but then for the shoulder you actually used cupping. What was the reasoning there? You didn't put needles in the shoulder, you put cups here, but you put needles here.
Because I through the meridian, the energy flow. Then I choose where is the blockage, where is the locked energy, and I put the needle.
Okay, so the needles broke the blocks.
Yeah. And get the energy flowing. And the cupping is help suck out the toxins.
So the cupping removes the toxins from the area of the pain, but the needles increase the blood flow. See, that's what I'm trying to understand. Why they do differently. And so what does the moxibustion do?
The moxibustion is they do different things. They can increase your body energy, then actually they can get the blood flowing.
Okay.
Yeah.
So more similar to the needle in some ways.
Yeah, right.
Yeah. Okay. Interesting. Wow. Well, I'm trying to think. Yeah, I'm pretty much getting to be done, but one question I have is, we talked a little bit about this when you see that some of your patients have medical conditions that need more attention, like a heart condition, you refer them to a doctor, medical doctor. But what kind of other supportive therapies outside of TCM do you find that your patients can benefit from working with, besides medical doctors? What other kinds of professionals do you feel like you can or you do refer your patients to?
Example, like sometimes I worry for the patient to see the chiropractor.
Okay.
Yeah, sometimes I was asking them go see the massage.
Massage.
Yeah.
Okay.
So then, I think a lot of time is most is I refer them go see the doctor. Like example, like the I have the patient, and when I find out like the limp, so then we talk to them, go see the doctor and check, make sure it's not the cancer. So, but actually it's several patient and go see the doctor, is the cancer. So
you find it first with and then you refer them.
Yeah.
And they find the cancer.
Yeah.
Do you feel like the traditional treatments for cancer, such as radiation, chemotherapy, and what's the other one? Surgeries. Do you find that those are? Do you find that those are effective for treating cancer?
Depend on is what's type. Yeah. But I think like a lot of time can work together. Yeah.
Both can help.
Yeah. Like I have the several patients when they are coming here, and then but at the same time they do the chemo. Yeah.
We mentioned early on that one of your biggest challenges with patients are that they don't always follow your suggestions. Do you feel like some of them can benefit from working with a counselor or some kind of coach to help them change their behaviors and change their mind and thinking around changing their behaviors? Like it's too difficult for them, so because they have maybe some kind of emotional or the habit energy is too strong or something's going on to block them from making the change?
Yes.
You think they can benefit from that kind of work?
Yeah.
Yeah. Okay. Because that's work I do. I try to work with people to change. And like you, I also find it very challenging because some people resist the change. maybe for some reason they're not ready, or they can only make a little change at a time very slowly. Some people just aren't ready. They just want to, like, they'll come to me and say, I need you to help me lose 20 pounds. Just that, only. Nothing else wrong. I just want to lose 20 pounds. And I will say, so the 20 pounds is related to many different things that you're doing and not doing. So we can't just talk only about losing the weight. Anyway, if you go on a diet, you will just gain the weight back. Have to make lifestyle change, which is a bigger picture, you know. And it has to do with their understanding of what nutrition is and what health is, and sort of make more of an investment, put more energy on their health. So, okay. Well, do you have anything else that you'd like to add to my questions? I know I didn't cover everything because you could do so much, and like your history, you know, I have so much information on your website about, you know, your background and your family and how you learned, you know, the art, and it's all there. So I didn't want to ask you to say over and over because I can read it, you know. But I tried to pick questions that were not clearly on your website or on your brochure. But is there anything else you would like to add to?
Yeah, I think you're pretty much.
Pretty good? Okay. Well, what I'll do is then, when I write the article, I'll send you a draft copy for you to review before I send it in for publication. And then